Hello, I'll be saying now the important questions in the region of the lower limb. To start with the essay questions coming from hip to the foot, gluteus maximus and structures under cover of it, number 1. Number 2, the hip joint. Number 3, the femoral triangle. Number 4, the sciatic nerve. A problem can be framed for sciatic nerve. Number 5, hamstring muscles. Number 6, the popliteal fossa with popliteal artery. Number 7, the knee joint. Number 8, the common peroneal nerve. Number 9, the arches of foot. Mostly these are the questions which can be asked as an essay, of which hip joint, knee joint, arches of foot, sciatic nerve and popliteal fossa are more important, and even femoral triangle. Coming to the short notes, inguinal lymph nodes or the lymphatic drainage of the lower limb, superficial and deep inguinal lymph nodes and popliteal nodes, which you need to write. Then an entity of femoral triangle, that is the femoral sheath or even femoral canal. Below downwards, the adductor canal, femoral artery, femoral nerve. Femoral artery in fact can be an essay question also. Anyway, you are reading it when you study the femoral triangle. Femoral nerve also can be a question. Then a muscle like popliteus, it is usually asked because of its unique action, that is unlocking of the locked knee. And similarly, muscles which can be asked a bit above is tensor fasciae lata, and even the iliotibial tract can be a question. And particularly for brief BAQs, the three anastomosis, that is the cruciate anastomosis, the trochanteric anastomosis and the spinous anastomosis can be asked. Even saphenous opening is a very good question as a BAQ. Coming further downwards, if you see, the dorsalis pedis artery is more important, followed by the retinacula of the foot, and lastly, at least knowing the structures in the layers of the sole. For a brief answers, like the question can be enlist the structures of the second layer of the sole, enlist the structures of the third layer, something like that question can be framed. This is all about the important questions in relation to the lower limb. And one more important one which I forgot in essay question was the venous drainage of lower limb, for which a problem can be framed with relation to the varicosities. And finally, you need to write the great saphenous vein in detail and even the small saphenous vein and the perforators. This also can be a question. This is all about the lower limb. Thank you.